Good morning. Welcome
Good
to
morning.
the Medicare Cafe. Oof.
Last one of 2025.
Last one of 2020. Ooh, last one of 2025.
Last one. This seems really tall. Is it?
Actually, this is a direct. Who was sitting here last time? Jalen? Jalen's pretty tall. Okay. He's got a long torso, if you will.
Is that okay? Now
you know
I don't
there
have
are
to
people like
lift up my
that
chin.
though. Like when I sit down with them, we're the same height, and then it has been. We sit down, we're the same height, and then when we stand up, I'm like, oh, you are all legs.
All legs, yeah.
Welcome. We're going to get started here in just a second, but as always, you're joined by your host. My name's Olivia Richardson.
And I'm Kari Vogt.
And I'm so excited to have Kari back. I haven't seen her since the holiday season, which we're still in.
I mean, I think it's been 4 weeks since I've been here.
Yeah.
Because I had to miss the last one.
Well,
I was
it was
scheduled.
AEP.
What was it? Yeah, but
AEP was the thing that you were doing.
No, the last week of AEP, remember we had a snow day.
Yeah.
That's what it was. We had a snow day.
Yep,
and I had to reschedule all my Monday meetings to Tuesday. And I was like, I'm sorry, Cafe.
Sorry, guys. It's
the
weird that,
week.
you want to, you have a single day left to do all of your business and you didn't want to hang out with us instead, honestly.
I did want to.
Well, that's fair.
I would have much rather.
So I walk into the studio and she looks at me before she even says, hello, good morning. I love your outfit, which by the way, this outfit, Alex posted a short today of me and Kari, and I look the exact same.
Am I wearing the same?
No, I would have remembered this.
Okay.
Apparently, I am I'm a fuzzy caterpillar. This is my caterpillar sweater.
It's a good day for it. It's cold.
It's so cold. So speaking of cold day, I'm walking in, just put my coffee down, just got out of a meeting, and I'm like, hey, sorry, I'm running a little bit behind. Kari looks and she goes, you want to get a good laugh? And I said, of course I want a good laugh, before even acknowledging my existence. That was the acknowledgement of my existence was, do you want to get a good laugh? Kari, show the audience what you brought into the office today. I have to. Show all of our friends. Kari brought in sourdough. She said, because why? You have to explain to the audience why you brought in.
If you don't know
your home ec
sourdough,
project.
so you have to start the process the night before, and then there's a 3-hour gap in the morning where you have to do your stretch and folds. And I just was totally not thinking about being here. I was not thinking about being here today. I don't know. Bread was just on my mind.
Understandable.
And so I was like, you know what? I'm just going to bring it in the car. I'm just going to bring it. And right before and right after, I'll just get my little stretch and folds on. So here we are.
See, when I hear stretch and folds, in my head comes the Olivia Newton-John, let's get physical music video.
Oh, yeah. Well, because you don't knead sourdough. You
really
stretch it and then you fold it over. And then you stretch it and then you fold it over.
I love it. Good morning. Well, he says, good morning. Happy missed New Year? Almost. Got it. I was going to say, I thought there was a Happy New Year's Eve. The all mist. Which, by the way, in Missouri, we've been having today's the first time we've seen sunlight in so long. It's been nothing but just a cloudy mist. Kind of terrifying.
Not in Branson. I was literally swimming on Christmas Day outside. It was 80. It was a heated pool. It was still cold.
That's wild.
But I swam 2 days last week.
Well, I didn't get to even see the sunlight, so there's that. Guys, welcome to the Medicare Cafe. As always, if you'd like to interact with us like a good friend will here, go ahead and put your comments in the chat feature. We'll read them live on the show. Or if you'd rather just be a little secret sleuth, you can always text me. This is my real phone number right there. That is my phone number. So you can text me at any time. Even I got some good Merry Christmas texts over the holidays
sourdough
too.
questions, whatever it is.
Don't ask
relay
me the
those
sourdough
to me.
questions. Quite literally, I'll say I don't know. That sounds really scary. And I'm not afraid of commitment. I have a husband now of 9 years and a 5-year-old son. So I'm okay. And I've been here for 13 years. So
this is another
child.
child. This is like another child.
Oh, I don't know. I don't know that I could commit.
You've got to feed it and give it love.
No.
Not forget about it.
No, I never had a Neopet. Not Neopet. What was the things, the Tamagotchis? I never had one live more than a day. Yeah. Today on Medicare Cafe, what we're going to talk about is OEP do's and do nots, aka don'ts. There's literally OEP. A lot of people, I kind of see there is a way to do it correctly, and there's a way to do OEP very incorrectly. And it's not the way that you think. A lot of people, we'll get into it today with the do's and do nots, but a lot of people are kind of too scared to really do a whole lot during OEP because they're worried about compliance. And then we have some people that will, I'm giving away all my good secrets.
I talked about OEP, AEP more than I've ever talked about it, ever. Like this past open enrollment, I talked about AEP more than I ever have before because
OEP
I had
more than you ever had before.
OEP. Sorry.
Yeah.
Sorry.
I'm
Yes.
back.
Sorry.
Brain malfunctioned. Okay.
Too many acronyms. Just because so many people changed Medicare Advantage plans that had been like in a plan for so long and they were nervous to change, but they wanted to change. And so I just snuck in that, try it out. If you're not happy with it, like you still have a second chance beginning of next quarter if you're unhappy with it.
What a great move. And again, like you probably saw this, I know you already said this, more this year than last year because one, so many people have switched to Medicare Advantage plans or starting out with Medicare Advantage, not even trying the Med Sup route. And two, there was so much disruption for the second year in a row. So people are maybe less trusting of their coverage.
For sure.
Less trusting of what is this carrier going to do.
Because like I could see it in them. Like I had just so many people who they wanted to change so bad, but there was just like a little hesitancy. And by me saying this little thing about OEP, they were like, okay, let's do it.
So did you move them from, sorry, carriers, I know I'm not supposed to say carrier name specifically, but did you move them from like UHC to Humana?
Yes.
So here's another theory that I have, because I'm hearing that kind of regularly about people really anxious this year. UHC is such a strong brand. They do more advertising. People are familiar with it. It's more prevalent in the underage market. People are so much more familiar with UHC that there's just an innate trust, just being the familiarity of it. So to go to something which Humana is incredibly well known. It's a huge brand, as much, if not more, advertising than UHC does, but it's still lesser trusted because people have less experience with it. So that transition of just like moving away from a lesser, like branding and familiarity.
Or people that have been with Anthem for a while. And then Anthem had to
being
had
in
to
this
leave.
area, especially being such a prevalent one.
Yep.
Let's get into the first of my do's and do nots. My first one is going to be a don't. Don't be afraid, and it's the number one reason why people are anxious during AEP or during OEP. Do not be afraid to market OEP. Now, let me be very clear, because the number one here is that, well, I can't. Compliance says I cannot market OEP. Let me set the record straight here. What CMS is saying, compliance associated with marketing during the open enrollment period, which again, for those who don't know, runs January 1st through March 31st. What people don't understand is that it's saying that you can't, it's all about the call to action, and it's marketing versus communication. You can't go out and try to gain new membership under the advertisement or the lead generation associated with OEP, meaning that you can't go out there and start running advertisements that say there's still time to switch, it's OEP, come work with me. You can't just run blanket advertisements that advertise OEP as an election. However, you absolutely have the ability to communicate with current clients and prospects that OEP is something that exists. It's all about the call to action. If the call to action is there's still time to switch, give me a call, that's going to be a no-no. If the call to action is let me know if you have questions about your current coverage, let me know what questions that you have. You know, it's all about communication, or even down the worlds of educating. When it comes to like prospecting, it does get a little bit more hairy about what you can and cannot say. But you can actually do a social media video about like, here's what you can expect in 2026. And here's a video about here's what,
educational.
Just educational. Here's what you can get. Now, what you're going to have to worry about is what's the call to action. It's a call to action. You still have time to switch. Call me. That can't be your call to action. So it does come down to that. But you can absolutely, and to your current clients, it's kind of all bets are off. If they currently have a Medicare Advantage or prescription drug plan with you, then well, truly just a Medicare Advantage, because this doesn't affect PDP. But if they have a Medicare Advantage plan with you, you can actually reach out to them and say, hey, you still have a chance. If you don't like your coverage, if you don't like your plan, they are a current client of yours, call me. We can move you to a different plan. We have until March 31st. So it is truly about like when people say I can't market this, no, it really comes down to the intent.
Yeah.
Are you intending to educate or your call to action? You can't say, come in. I
kept a list of my current clients of who I knew were hesitant. And I've got it, I don't remember, I think it's like the first or second week of February, to like call all of them and check in. Like, you've had your plan a month. How are you feeling?
Oh, you're beating me to my due.
Oh.
Okay. I love it when we're on the same page.
I do too.
So don't be afraid to market. And actually, my due, before I get into that due, cut the do's. So don't be afraid to market. Again, you can do marketing versus communication, calls to action, new clients versus current clients. Do continue your normal marketing. So seminars, if you did seminars during AEP, you can still do, like, if you were a huge in doing like carrier branded webinars, or not webinars, sorry, seminars, still do seminars, do sales seminars, do educational seminars, do kiosk, whatever you did during AEP, it is wise to continue that activity during OEP, and just making sure that your signage and things like that does not include open enrollment period. Because again, you can't market that it's OEP. Good morning, Madeline. But still continue your normal marketing. Most people, when they hear you can't market during AEP, they shut down everything. No, keep going. Keep doing your thing. Another do not. Don't assume that your clients are all staying put. Don't assume just because you saw them during AEP, even if they decided that they needed to stay on their same plan or they switched, does not matter. Do not assume that your clients are staying with you throughout OEP. Primarily, one of the biggest reasons I hear about this is that, especially with my people will say, I have the most loyal clients. There's no way that they wouldn't leave me. Well, oftentimes it's because they get confused.
Yeah.
They get a call from somebody. Yep. Yeah, of course, we're not supposed to be marketing during OEP or marketing OEP, but it still happens. Call centers still do it. They find ways, including like there's still a ton of other SEPs, including disaster SEPs. Those are still going on right now. So there's a ton of reasons why a person can still move during the first part of the year. Companies are still investing and pumping a ton of marketing dollars into gaining new clients. So it happens all the time. People get confused and they end up enrolling into a different plan and they don't even know the wiser. So if they have, or like they'll call the carriers and say, I have questions on this.
I feel like that should be illegal. I feel like the carriers should not be allowed to, if somebody calls in with like questions, like they should not be allowed to switch them.
Now,
think they shouldn't.
I completely agree. I think what a lot of carriers advertise, but sometimes it gets lost and you have to fight for it, is that if a client calls in and they switch plans, then the agent still gets the commission. The agent's still agent of record. A lot of carriers will advertise that, but like oftentimes like you have to go through your book of business and find out when it happens.
Yeah, I had a client who she had a MedSup and a PDP, and she called United Healthcare she was like, oh, my friend has a United Healthcare dental plan. I called them, signed up for it. She was like, I don't just get dental, I get vision and hearing too. And I get an over-the-counter benefit. And I was like, no.
Yeah.
So,
and they don't know. It's not like they're purposely saying, I don't
She was like,
it
just sounded good. And I was like, do you know you changed your whole medical, everything?
You changed
everything. She was like,
everything.
no, I didn't know that.
Because they called the number on the back of their card. It is so important as an agent, especially in the Medicare field. It's why we get renewals. It's why we get residual commissions. It is so important that you tell your people, do not call the carriers, do not call Medicare.
And in my defense, she wasn't an actual, she was a prospect of mine. She wasn't a current client.
Sure.
I trained mine better than that.
You train and again, but the most well-trained clients are still going to answer the phone. They're still going to have questions. And oftentimes they think, oh, Carrie's so busy. She's done so much for me. I'll just handle this. This is easy. I'll just handle this on my own.
Oh, yes. So many people do that.
It's not.
I didn't want to bug you for this. And I'm like, you're not bugging me. Call me.
100%. It's so important that you train your clients that you are the first phone call no matter what. Because guess what? If they do switch, then that's a rapid disenrollment.
I tell you
which
what
is a
makes me very
violation.
mad. I know we're not supposed to talk carrier specific, but it really makes me mad that we can't set up the auto pay for WellCare. It's new premium.
I mean, that's WellCare. I mean, that's like, I 100%. Yeah. That was so frustrating. We found that out during AEP that agents couldn't do that.
I have had, I'm talking 50 plus people like mad that they haven't gotten an invoice. Can you is this something you can do for me? I'm like, I can't.
I would love to. I would
can't,
love
I'm
to make
sorry.
sure that you get to keep that plan.
Yeah.
But no, it's such a good point. It's there's a million reasons why a consumer will call a carrier, call Medicare, pick up a phone call, and it has nothing to do with your lack of service or they're not doing something well. There's a million reasons that happens all the time. So making sure don't assume that they'll be staying put. They'll get calls. They may have issues where it might be like a pharmacy issue. Like the pharmacist may mess something up. So they call the number in the back of their card and they say, oh, let me get you with this other plan. They'll switch plans. They may call Medicare. If they call Medicare, that's a complaint. If they call the carrier, they may switch in plans. So make sure that you train your clients to say, you don't call that 1-800 number. You call me or my staff, my office. You call me every time. Do a Q1 follow-up. Now, I say a follow-up appointment.
Yeah.
Do a Q1 follow-up. Now, I like a follow-up appointment. We have agents that do this 2 different ways. If you have an admin team that you get to kind of control what their schedule looks like, they'll have their admin staff call the clients and just kind of do a check-in, a phone checkup. Have you used your pharmacy? Have you gone to the pharmacy yet? You were really interested in that gym membership? Do you need help picking out your gym? Really stuff that takes time.
Yeah.
But what I like to do is I like to make those an actual appointment, because you got to make sure that your time that you spend or the time that you invest results in income. That's always is. Time is actually money.
For sure.
And so sometimes it's really easy to view, if you're just doing a phone call with a current client to make sure they're using their benefits, it's hard to actually measure the dollars that come from that. Now, obviously, dollars do come
It's
because
just good customer service.
you get retention.
For sure.
You get referrals. There's a ton of but what I like to do it as an appointment is actually set it up as an opportunity for cross-selling.
There you go.
So because, again, if you're into life insurance or annuities and things like that, obviously you couldn't have sold that during AEP. But AEP is so crazy. It's so wild that we probably didn't have time to talk to everybody about a cancer insurance plan.
Yeah.
Probably didn't have time to talk to everybody about hospital indemnity insurance coverage. So there's 2 ways that I like to do this is whenever the follow appointment is, hey, one way is I just want to have you come in office, make sure you're using the benefits. We can look through, set up your profile or download the app, because all these carriers now have apps and profiles that people can sign into to pay their bills or check the statuses on claims. So I can help you with that. Another approach is, hey, Kari, during AEP, I know you saw my post. You saw how crazy busy it was. I really appreciate you being so flexible and having time to meet with me. My job as your agent, though, is to take care of you holistically. And during AEP, I just don't have the ability to look at your plans and look at your healthcare holistically. Let's get a meeting, February, March sometime. We'll review your plan, make sure you're liking what you're on, because if you don't like it, we can switch you at that point. But I also just want to do a full review to make sure that you are fully covered in all the areas you might be a little concerned with.
I need to do better at that.
Yeah. But it's a really great way to get them back in office.
Yep.
They're going to stay with you. You can fix any mistakes that they accidentally do during OEP. And then you actually make new dollars off of it. You actually make a new income off of that. So I'm a huge fan of the Q1 appointment. There's also a program called Legacy Safeguard. I don't want to get into today, but what it is a way, I won't get into the details today, I should say, but it's a way to actually set up life insurance by a funeral planning service. It sounds really, really dark, but it's a really cool program, free for you to offer.
We haven't talked about that in a while.
I know it is.
I need a reminder on that.
Maybe the first episode in January, we can start by talking about death. Happy New Year! But we'll talk about Legacy Safeguard, because it is an incredible way to get referrals, an incredible way to cross-sell life insurance and final expense. And they call it the postseason game plan, which is you go through all of your AEP appointments and offer them a Legacy Safeguard membership.
Did you get your member card? Have you updated your doctors with the new card? 2 things I heard recently that is less invasive.
Yeah. And again, I know a lot of people, again, are worried about being invasive, but, let me say, this is going to take this how you will. A lot of people are really nervous about the Q1 appointment because they don't want to seem salesy. They don't want to seem pushy. I'm not worried. If I go to my doctor's appointment because something hurts or I'm sore or something is ailing me, I'm okay if my doctor's a little invasive.
Yeah,
I'm okay if my doctor's
for
asking the
sure.
questions and really getting in there.
For sure.
So your job is equally as important because a doctor can't do their job, or more, the doctor won't do their job unless we're doing ours. So if I don't mind a doctor being invasive about asking me some private questions, then I shouldn't be worried about asking my client private questions because they probably want to be able to fund that doctor's appointment. And that's where I come in. I have one more don't. Don't forget that other SEPs exist. There are still the service area reductions that goes until SARs goes until February, the last day of February. It's not a leap year this year, is it? No. So February 27th. So
It's not a leap year?
I don't think so. Is it?
No.
Alex, is it a leap year?
Okay.
Well, either the 27th or the 28th. So SARs, and again, the
28 days.
28 days in February? It is a leap year.
28 days.
Ooh.
People are finally aging.
People are finally aging. So making sure that you are doing, again, people are still, and here's another thing that people don't think about. This is also the number one time of year when people retire. And so,
Oh my gosh, yes.
So many people have retired or lost their group coverage, and a lot of them used AEP to enroll into a plan. They still have the retirement SEP.
I have about 8 that I can think of that I have 4 couples coming to mind that are all retiring in January.
Yes. So many people are losing their coverage, and so that the retirement, the loss of employer group health coverage, that's still an SEP. SARs and SEP, people are still aging in and turning 65 in January, February, and March. I know that's crazy. Birthdays still exist at a time of year. So again, there's just, don't forget, OEP isn't the end all be all, which again kind of leads me to my other do. Continue in your normal marketing. Yes, OEP is a tremendous opportunity, but I also know we have a partnership with Deaf Research, and George Dipple was talking to us about the OEP, and gosh, I'll have to look for the exact stat, but was telling us exactly how intense this OEP is going to be. It was the largest OEP in history last year. They're expecting it to be even more so this year. So yes, the OEP opportunity is going to be raining on us, but there is still a ton of opportunity outside of OEP too.
Will asked if someone qualifies for a SEP versus an OEP and move in the middle of the month, will they still have to wait until first of the next month for effective dates of new coverage?
Yeah. That's Medicare Advantage and Part D. They do not, there is no such thing.
No middle of the month rule.
They're always the first of the month. There is no, that's just Medicare Advantage and prescription drug plans, always the first of the month. Other coverages like MedSups, hospital indemnities, a lot of other coverages. I've never heard of a
MedSup having a middle of the month
All
start
of them.
date.
The only ones that doesn't allow it is, I don't think Mutual of Omaha allows it, and United Healthcare. But every other MedSup will allow a middle of the month start date. Most people don't, but you absolutely can. Which is why whenever people are selling, if you're selling a hospital indemnity plan or a dental plan to somebody, even if they aren't turning 65 for a few more months, go ahead and get that effective date immediately, so they get that coverage even prior to their A and B starting when it comes to ancillary.
A lot of them have drop downs that are Jan 1, Feb 1. I'm intrigued.
If you're looking at a
Sigma
CSG,
you right in.
if you're looking at a CSG, it's always gonna have a drop down of the first of the month. But absolutely,
I on the carrier portals is what I'm going through in my mind.
Well, I know for a fact that most Medicare supplements will allow a start date throughout the month.
Interesting. Learned something new today.
And then I have one more do. Ride the momentum of AEP. This was crazy.
This is gonna be hard for me.
I know, and then especially
I tried to work yesterday, and I was like, "How do I do this?"
I did. I sat down at my desk yesterday.
What is this thing in front of me? This keyboard? How does it work?
I had to sit down, and I was working yesterday, and my son was home because school's closed. So I was working remotely yesterday, and I sat there and was just staring at my screen. And I had I literally made a to-do list of all the things I need to get done before.
Did you get 2 of them done?
I don't know that I got a thing done.
Yeah.
One of them got done on accident. I know, and I was just I don't know. How do I?
It is so hard to get yourself back going after just going nonstop.
I know.
Usually once I make my goals for 2026, then I'm okay.
Yeah.
I can do it.
I can do it. Well, that was actually, I'm really, okay. So
but there's no sense right now in trying.
There's no sense. No, because.
Especially before New Year's.
Do you have any, what are your plans
Kids are
for
still
New
home.
Year's?
We always have a pajama party. But I have a sick child. So
Oh,
no one's
hopefully-
coming over anymore.
Hopefully she's better before then so she can at least enjoy it.
I
with
know.
You guys.
Yeah, we might go to a movie or something tomorrow.
Yeah, that's fun.
But-
We always, we're not always, we're doing it the first time this year is we go on New Year's Day. We're going on like a big side-by-side ride with a bunch of us.
Oh, yeah,
and going out to dinner
fun.
somewhere. All the kids love it. Cade has a bunch of kids. He has no idea he's 5. He thinks he's 16 because all of his friends are 10,
Older.
11, 12,
Yeah.
you know, so he thinks he's just a little teenager. But we're going to go do side-by-side rides and then bed early. I'll just push a clock forward.
Oh
so he
yeah,
thinks
we
he
always
stays
have
up all
midnight at
night.
like 7.
100% same. Like for Olivia, for me, not.
Do you know
my
what's going
5-year-old.
off?
Your bread time? Okay, we will wrap up, guys.
Oh,
It is bread time. But those are my do's and don'ts of OEP.
Oh.
Just to keep it really simple.
can
Don't
it be
overthink
can it be appealed if they have immediate healthcare issues, i.e. they are ESRD? I don't even think ESRD starts middle of the month.
No, ESRD. Again, when we're talking about Medicare Advantage and PDP, no. Now, what's interesting about ESRD is that ESRD, because there is a shorter waiting period, but still a waiting period, they will backdate the
yeah.
A and B effective dates. But I don't believe that you can backdate your coverage effective. That would be a really good question if you could say this Medicare Advantage plan would have been effective 12/1.
I think it's just A and B they backdate.
Right. But I was
Yeah.
wondering if no, I don't think the Medicare Advantage plan would.
Is taxes, Social Security check eliminated?
Oh, no. It's Donald Trump says that he was going to eliminate taxes off of Social Security income. And I don't know the details 100%, but he's still talking like that has happened.
Yeah,
it has not
nothing's trickled
happened.
down to me yet.
Yeah, nothing. No, you are still paying taxes on Social Security income, unfortunately. What they're doing is that there's other tax breaks that are being associated with Social Security income. And so they're kind of saying, yeah, we're eliminating tax on Social Security income. That's not true, but there are other tax breaks that are coming in other locations. So they're saying if A plus B equals C, then A equals C. I don't know. I thought I was being clever with my letters there, but I failed miserably.
I was kind of with you.
Oh, I appreciate it. Thank you. Thank you for trying. I don't know what I'm saying half the time, but that I do know. No, taxes on Social Security checks are not being eliminated as
No.
of now, but the wording is confusing. Guys, that's what I have today. Merry
Some
New
good
Year.
do's and don'ts.
Merry New Year. Happy Christmas. Thank you guys for spending the time with us. We have a lot of really cool stuff planned throughout 2026. Actually, the other day I told someone like, oh yeah, it's going to be 2027. They're like, you skipped a whole year. And I said, well, I'm so used to talking about 2026. I'm so used to talking about it.
Yeah.
The last point I want to make was you talked about goals. This is just, I want to talk about me for a second.
Okay.
Every year I come up with the word of the year. So in 2024,
like your word
my
of the year?
word of the year, where
Okay.
I'm going to kind of like just like, if what I'm doing doesn't serve my word of the year, then it's not worth doing that
Okay.
year. So in 2024, my word of the year was progress.
Okay.
In 2025, my word of the year, oh gosh, I can't remember it now. Oh my gosh, it was a long year. It was another P word, but it basically meant, purpose. No,
Purpose.
2024 was purpose. 2025 was progress.
Progress.
2026 word of the year is going to be execute.
Execute.
Execute. I either need to start, I've done the progress, I've done the purpose, I've spent so much time evaluating. 2026 is time to get the stuff done.
Okay.
And if it doesn't serve me, I'm executing it. We're done with it.
There you
so
go.
word of the year in 2026, y'all watch out.
I like will.
Execute.
That's my word of the year.
Carbs. I'm carb
Bread.
loading. I'm carb loading for 2026. Kari, thank you for coming in and bringing us your yeast child.
There is no yeast in
I
sourdough.
don't know. I'm sorry.
Only the fake kind.
Oh, because this one likes cold.
Sourdough is fermented, so it has its own rising leavening agent.
What's beer bread? Is that yeast? Yeah.
Yeah.
Okay.
Yeah.
I got a beer bread.
All
mix
breads will
that I've
have
had
yeast
about. Not
except
sourdough.
sourdough. Except sourdough. Yeah.
I learned about this at the Budweiser place.
Yes, at the Q Council.
I knew that. But anyways, we've digressed. We've digressed. All right. Have a wonderful rest of your week. Join us next Tuesday for the first Medicare Cafe of 2026.
2026.
And until next time, have fun
Make money
and give impeccable service. Thanks, guys.
Thanks.